I'm Dr. Craig Slapinski, and I'm the clinic director here at the Spine and Nerve Center. And today I want to talk to you about one of the most common surgical procedures that are performed to treat chronic and severe back and neck pain. If you've gone to your doctor complaining about severe chronic back or neck pain or pain that's radiating down your arms or legs, more than likely your doctor took an MRI. And if they diagnosed you with a disc bulge or a herniation or spondylosis, they may have recommended surgery for you. And the most common type of surgery that's performed here is called a laminectomy. And in order to know what a laminectomy is, we need to look at the model. So we have a model of the spine. These are the two vertebral bodies, and it's separated by what's called an intervertebral disc. And then we have the spinal cord and then the nerves here. So if we have a problem with the disc is bulging out and it's hitting the nerve, and that causes the pain and the radicular symptoms. So what they do is they cut part of this bone out. It's called the lamina. These are the spinous processes. These are the bumps that you feel at the back of your neck. And they remove this bone to alleviate the pressure that's caused by the disc coming out. So that sounds like a great option, but why would we try to avoid surgery? Well, first, it's a surgical procedure, and any surgical procedure comes with risks, such as infection, bleeding, and you might have a reaction to the anesthesia, heart attack, stroke. These are all possible reactions to having any kind of surgery. The second reason we want to try to avoid this type of procedure is because in order to get to the bone here, we have to cut through a layer of fat, skin, and muscle. And once we get to this bone, they remove it. And this bone is here for a reason. This bone is here to first protect the nerve, and second to create stability in the spine. So if we remove this bone, we're creating instability, and also we're tearing some of the muscle, and then we're causing scar tissue to develop. And the final reason I don't recommend or try to avoid surgery as much as possible is something called failed back surgery syndrome. And what failed back surgery syndrome is when the surgical procedure does not go as planned. It's when you come out of that procedure with the same amount or more pain than you did going in. And I read an article just yesterday that talked about 30% of the patients that undergo a laminectomy have the same amount of pain, if not more pain, 12 months following the procedure. And after you have something like this performed and it doesn't work for you, you can't go in and say, hey, I don't like how this turned out, please undo it. It doesn't work like that. Often if people that have had failed back surgery syndrome, the solution is to have another surgery, and then to have another surgery. And then after that, it's to be on persistent pain medication. So again, you owe it to yourself to do everything you can to avoid surgery. If you're considering a procedure, you're welcome to give us a call, and we can review your MRI with you and look and see if there's anything that we can do to help you avoid surgery. Thank you, and have a great day.